Have you guys started audio yet?
Do you hear us now, guys? Can you? Okay,
Yes, thank you. Yes,
okay, great.
thank you. Just started.
So we are waiting for Steve because he didn't indicate that he's going to be late. So we'll wait for a few more minutes.
Yes.
Sounds good. Thank you.
Time.
And then I 2 weeks ago, I just did Boston.
Oh, you did Boston.
That's both of them.
So what happened on Japan?
Yeah.
I'm not sure.
Yeah, I was in Tokyo 2.
And you ran.
I went to Tokyo, America. Yeah.
Yeah. Oh, well, that's fantastic. Is that your first in Tokyo? I would
First
imagine.
Tokyo, yes.
And what did you think about?
Which
Because the airplane is horrible.
the worst part about the trip was
We
the
have
flight.
no, yes, yeah.
One
My
month.
daughter works for CB12M Banking Corporation,
Oh, nice.
and she did a 2-week trip.
Over here, though?
Yeah.
And everything was set up when I.
Hi.
Is that my picture somewhere?
Yeah.
There's more, we should bring those.
Food. There's a whole group of you that.
I was still working here.
They came to me and they think that what's.
So you had a good group that you already knew.
Oh.
I tried to set up all in the same hotel.
No.
Well, I think I've seen you.
Yeah, they're walking distance.
Okay.
Thanks. Hey, Paul, can I ask you a question? We need to mute the.
Sure.
Okay. Sorry, hold on a second.
Is
the volume on?
Global, so they only receive.
Okay.
Work. And we do all six, you get
He's on the
special medal.
Zoho.
So that was.
No.
So I did, once.
Very good.
Thank you.
Johnny, you got the special one, the colored one.
I got the colored one.
You sure did.
I am special.
Nine.
Thank you.
You're very welcome.
Thank you.
Hold on, I'm just, I think we're good, right? Yes, thanks. Actually, maybe I should wait when we start the meeting. I was gonna ask you about the rabies rate. Is that, what you indicate last month is that, or there were no rabies, in our district? All the animals you got only one bat? Okay. The question is it what the reporting that you got is from DOH, or was it only the animals that you guys got at your door?
So it was DOH's report for the entire city. I think it was all but one of those animals came through us.
I see. Okay, because some people are bringing animals to private vets and then they send it to
Correct.
DOH. So I wonder, okay, so now I know it's
So
the entire-
generally what happens though,
Mhm.
like if there's a specimen that needs to be tested, DOH will contact us, we go pick it up, and then we process it through.
I see. Okay. So your report is the entire city, no matter where the animal went to, but that's a report for the entire city.
Correct.
Okay, that's good. Excellent. Because we have, there is like a, I don't, well, I'm just gonna say, there is some rabies scare. People are concerned, not necessarily in a logical way. And I think we have more concern, I mean, like, people should be more concerned about distemper. Is that something that the Department of Health also,
Distemper is pretty much rabies.
well, just two different things.
The two every day, but they were all tested under the same way. So
Okay,
yeah. And just so you know, I mean, I could send you over the link, because I think I already sent it to you before, but they finally put up for 2024, there's been only one animal in the entire city that's tested positive for rabies in 2024, and it was in Staten Island.
okay, okay, but there was one you reported from, wasn't it a bat from Upper West Side or something?
That was for 2023.
I see. Okay.
Yeah,
All
it was at Columbus and West 87th.
Okay, so we are in a pretty good shape. All right, so
Yeah.
so my point is just that when people are asking, I want to make sure I'm giving them the right information, and I didn't want to say anything before I recheck with you.
Yeah, no problem.
Okay,
And I'm looking right now, in 2023, Manhattan only had that one bat for the whole entire borough.
okay.
There was nothing in 2022. In 2021, there was one raccoon, Seaman Avenue and Payson Avenue. And then 2020, there was two raccoons, one again on Payson Avenue and Seaman Avenue, and one on Bogardus Place and Hillside Avenue, which I think is downtown.
No, that's actually 10040. It's our district.
Bogardus Place is Bogardus. I thought Bogardus Plaza was downtown more.
I don't know about Plaza. I know Place is in.
Yeah, I didn't mean Plaza, I believe. But does Hillside cross? Oh, so then it's your district. But that was in 2020. So there hasn't been anything, I think, in your district since then.
Okay, that's great. So we know.
Yep.
Did you get my message?
No, well, Jen. No, I did not. But you're here, so does it matter if I got your message?
Yes.
Okay, well, I didn't get it. It's okay. In the meantime, I asked Paul about rabies information. So, Paul from ACC is with us. Isn't it awesome? Yeah,
Oh,
yes.
and a special uninvited guest.
Invited, always invited. Come on,
Always
Steve.
invited, okay. Always invited, okay.
Always.
He's always welcome. He's only-
And invited.
Well, I think so. Oh, did you invite him? I didn't invite him. He's welcome anyway. Okay. All right, let's get the show on the road. Mr. Banis, are you ready?
No, do we have a updated agenda?
Yeah, that's it.
Thank you.
There you go.
Someone.
Oh, this is not it.
Oh, that's not the updated agenda.
Oh, this is it. I'm sorry.
Thank you. Okay, now I'm ready.
Now you're ready?
Yes.
Right behind you.
Oh, very good.
Places everyone. Places everyone.
Places?
Thank you, please.
All right. Okay, Elvin, are you ready?
Yes, sir.
Okay, good. Okay. All right, sorry I'm late. All right, so we were gonna have a special presentation from students at the Wheel School today, but they canceled and requested permission to come next month. So we'll go over it later, but we now have three possible presentations for next month's meeting. So welcome everybody to the Community Board 12 Health and Environment Committee meeting of May the 2nd, 2024. I hereby call this meeting to order at whatever time it is, 7:15. I'm joined by a great group of committee members, loyal members who come month after month and hardly ever complain. O.C. Kaminer is my assistant chair, Elvin Adamus, Jacob Banis, we're a loyal secretary, Heidi Guzman, Jody Herson, and Carmen Paulino. Gotta check on what's going on with Jay Mazer. Don't know whether he's been recovering or not. So our agenda begins with Sandra Harris, who does not appear to be here.
Oh, there's no one in the attendees. So I guess not.
Yeah. All right, so we'll move on to our report on the latest statistics on COVID-19. And I'm going to give that report briefly. This is from the Department of Health and Mental Hygiene website, fresh off my computer from about an hour ago. And amazingly, it looks as though in the 28-day period between March 22nd and April the 18th, there might not have been anybody in all four of our zip codes that was even hospitalized for COVID. So
That's pretty awesome. Look at that.
that's just amazing. Somehow, I mean, this must be, I guess Pauline will be able to talk about this. This must be a trend throughout the city because our zip codes still end up in the middle rank of all the zip codes around the city. So it must also mean, I mean, we're ranked at, my zip code 32 is ranked at 83, zip code 33 at 84, zip code 34 at 85, zip code 40 at 87. So what that means is that there are at least 80 more zip codes which are further down from us. But I don't think there were people hospitalized in any of those zip codes either. So and as a result, I guess since we last met a month ago, nobody has in all four zip codes has died from COVID. There have been
Cheers to that.
yeah, there have been 77 new cases, but no new deaths. So let me turn it over to Pauline, who's going to be able to explain how we arrived at this very happy juncture.
Hi, good evening, everybody. So I am sharing my screen right now just to provide you with our website and all of the COVID-19 data. Can you hear me?
We're having some weird feedback.
Can you remove?
Oh, I'm sorry. Let me to a better location. Is this better?
It may be on our end. 1 second.
Can anyone else say something on the call? Because it didn't sound like that when Paul was speaking. Is that
Yeah.
right?
Yeah, Paul, say something.
Test,
Oh,
Yeah.
it's us. Okay.
test anyone?
Well,
No, not
no, he
really.
doesn't sound too good either.
Yeah.
He has a headset on.
No, it's definitely our speaker.
owl.
It's out of speak?
Yeah,
Okay.
but I don't know why.
All right, well, we'll,
Can you try again, please?
Can we mute this? And
I got it.
I think it's a loose cord.
oh,
Try again, everyone.
okay, Pauline, it's back to you.
Hello, better?
Oh,
No.
All right.
Okay.
well, we'll persevere on. So go ahead.
Well, I'll just keep it short then. So we are looking at the latest trends being pretty good. As you can see, total deaths, 0. Hospitalizations are pretty low as well. And then if you just want to search by neighborhood, you can see which ones have the highest numbers for COVID. So these are all really great data so far for COVID. Same with flu. I'm not sure if you guys are utilizing our flu site, but it looks like everything is trending in a downward trajectory, which is always a good sign. And sorry, here it is. I wish our website was a little bit more user friendly, but we do our best. So as you can see, we are here on the red line. We are trending down. So that's all great news.
Yeah. 1 second, you moved over now from COVID to flu.
Yep.
All right,
Pauline, I'm sorry. When you say we are the red line, what do you mean by we?
So
Manhattan?
currently this year, the 2023 to 2024, that's the red line that we are tracking right now. These other ones, the blue, green, lighter green. Am I seeing stuff, or is it blue, light blue, green, and yellow? Those are previous year's numbers. So you sort of can track and map out sort of what the trends look like in previous years as compared to this year. And we are looking pretty good in terms of coming down. We are still, on the high end compared to other years. But we are on this downward slope. So that's always a good sign. Did you want me to go back to COVID, Steve, or are we good with the COVID
no,
stuff?
do me a favor, that was it the hospitalization chart that you showed a few minutes ago? What was Douglaston at the top of that list?
It looked like that was the case. Let's go to the
Oh my
data
God,
tab.
I was there like 2 Fridays ago. Oh my God.
Well, you should be good because it's the 5-day incubation period. And then if you're feeling well, I think you should be good.
Yeah, I knew there was a problem going to Douglaston. Okay.
Right. Never leave your neighborhood, Steve.
I know, I try not to.
Nothing good can come from leaving Washington Heights and Inwood.
Yeah, you're absolutely right.
Right.
And by the way, that's why we're showing the film in the Heights on Friday night at 8:30 at J. Hood Wright Park. So thank you for giving me that. Thank you for giving me that opening.
That is so fun.
Yeah.
And then I just wanted to go back to OC's conversation with Paul as well. We have that nifty map on rabies. Oops, I spelled it wrong. On our website as well. So in case you are interested, we have this fun little map that you can download or look at. And so currently this year we have this teeny raccoon over in Staten Island who has tested positive. But we have map for previous years, and I have to say this is a pretty cute map, even though rabies is not cute. But we do have so we have it. We indicate it's a skunk or it's a bat, or a raccoon, and even a cat. So it looks as though our team over at the rabies unit have fun with mapping out sort of where we are seeing the disease pop up. So for your interested parties, please direct them to our website because we do report on everything.
If a raccoon, we've had a raccoon lately in Union Square Park during the daytime, and we've had to shut down the playground as a result. Speaking now, wearing my Parks Department hat. It's unusual, isn't it, for raccoons to be around during daytime?
No.
Well, I would let Paul probably, who's more of an
Oh,
expert,
yes,
speak
yeah.
on that. But to
Right.
my understanding, it's not necessarily unusual to see them in the daytime, especially if they have young, they're probably getting food. However,
Yeah.
if they're acting erratically or foaming,
Right,
then
right.
that is more of a concern. So if they're acting normal, they're probably just trying to get some extra nutrients for some pups that they're probably raising somewhere.
Yeah, Paul, did you want to add to that?
No, that's pretty much what it is. I will say
Oh.
this though, that if you do see it, if you call 311, they will contact us and we will come out and triage the situation with our animal field rescue specialists.
Yeah, I have to find out what our park staff has been doing. But,
But let's just, let's be just kind of clear about this, because the only way you would know if this animal tested for rabies or distemper positive, that it's euthanize the animal and just send it upstate.
That is
So,
correct.
right, so maybe just as a side thing, I know it's good to always be careful, but if the indicators that Pauline was indicating is not seen on the animal, then maybe we need to have more education as to what to expect, what to look for, and what to let go, and not upset an entire system for something that we see the rate of rabies and it's awesomely low. So that's something just to think about in terms of education.
all right, but Pauline, so flu is coming down and we're now approaching the levels that we've had in prior years. There was a question last month about TB and measles. Is there a recurrence of those diseases?
So not to a point where it's alarming. So we did hear about a case in Manhattan of measles, but that was like a travel case. But again, we are seeing sort of measles cases rising post-COVID just in general because of the lack of immunizations. And so we want to make sure we are continuing to encourage parents to have their children go back on a vaccination schedule if they're behind. We're seeing sort of diseases that we haven't seen in a while sort of pop back up because of that. And so we want to continue the education around vaccinations and getting parents and their kids back on track. So, but we haven't, no, to my understanding, there are no concerns in either category of TB or measles. So we just want to, just continue to encourage people to, get vaccinated. And then for TB, if they are in congregate settings and they're not feeling well, to get tested. But there's no major red flags right now.
All right, well, that's good to know.
And then also, I just wanted to give you a quick update about 600 West 168th Street. You did ask about the current occupancy. So, interestingly, you asked about the TB because our TB clinic that were located on the second and third floor of the building, their services are currently suspended. But we do have some staff that are still there, like operational staff on the fourth floor that they share also with Columbia. And then the fifth to seventh floors, Columbia is utilizing. And on the very first floor, New York Presbyterian Youth Hub is there. And then in the basement, there's a part-time program for seniors helping seniors. And that's the occupancy for the building. So, we don't currently take up a lot of floor space since the clinic is suspended for the time being. It closed during COVID, and it just hasn't reopened yet. I don't know the reason why, but if you're interested, I am happy to find out.
I'm sorry, go ahead.
No, go ahead.
I mean, what about the child health clinic that was there for years? Has that been closed too?
It doesn't look as though, I don't have that on my list, so I'm not sure if it's still there. So I will look into that.
I think that was on the first floor.
Oh, so the New York Presbyterian Youth Hub is still there.
Yeah. Well, maybe they took over the space from the child health clinic.
Right. That might have happened a while ago, though.
Yeah, oh
I
gosh.
don't remember there being a child clinic in my time at the health department, but I could be mistaken. So I'm happy to find out.
Okay.
And
Well,
then
it was definitely there. Well, at some, well, during my time in the neighborhood, it's been there. I don't know when it would have stopped though. So maybe you could look into that.
yeah, I'll definitely look into that for you.
Okay, all right, thank
And
you.
then I think the target for design completion is going to be like spring 2025, but I will definitely keep you all updated on the timeline.
Okay, um, and so is there vacant space in the building that you know of?
I mean, the only vacant space I would assume to be currently in the building would be the second and third floor where our TB clinic
Oh, yeah.
was, where the
Right.
services are currently
Right.
suspended. But I don't know whether or not there are plans to come back. And so
Yeah.
I wouldn't say that they're, not utilized space. It's just
Right.
currently not occupied. But I don't know whether or not it would be available for other services, for example.
Well, I think during the early days of COVID, I went to, I think to either the second or third floor for testing. So you were using that space as a COVID testing site early on during the pandemic. So, but at this point, evidently, you're not using it at all.
That's right.
Okay. Are there any questions?
I got it from the other room.
Elvin, no questions?
I have a question.
I knew it. I knew it.
Hello, Pauline, how you doing?
Good. How are you?
I have a quick question. Anything special going on for Mental Health Awareness Month?
I don't know of any specific
That's
events, but I will definitely check
Rings
with our
from the
mental
wall in
health
the other
team.
room. Sorry.
Thank you.
Good
Thank you.
question. Can always count on Elvin.
Mhm.
Anyone else? All right, well, thank you, Pauline.
Thank you.
All right, at this point, I thought we should have a discussion about the presentation at last month's meeting from New York Presbyterian about its plan to construct a Cancer Plus building at Fort Washington Avenue and 165th Street. But in fact, I was really hoping that Julio Batista would be here for that discussion. So you know what, I'm gonna
Can we
put that,
table it for next meeting?
No, maybe he'll show up a little later.
yeah, I'm gonna give him a call and
Okay.
see where he is, and I wonder where Sandra Harris is as well.
Everybody's ghosting us.
Yeah, God,
The weather.
It's too hot, the
Yeah.
weather,
Yeah.
it's way too hot.
yeah, all right, we'll make a couple of calls. Diane, you won't believe this, we're up to you now.
Wow, okay. Good, good evening, everyone. Let me try and find my camera and go on. Okay. So our data is consistent with the data that you've all been reporting this evening. So as of today, Isabella has no residents who are positive for COVID.
Very good.
Let's see, no hospitalizations during the month of April. Running at 98% capacity.
That's great. Yeah,
I'm sorry.
that's great news.
And what else did you ask me? Flu, nothing between April 4th and May 1st, which was like our last meeting to now. They just
Right.
that's why the time frame.
Very good.
So no flu, no COVID, no hospitalizations. I think that's about it. Continue to educate on getting vaccinations of all kinds.
Very good. All right,
This
and
evening's going too fast for you, Steve, right?
no, you're doing fine, but what was on the menu for lunch today? Do you know that?
I do not know what was on the, actually, I think there was something with sweet potatoes, but I'm not positive.
All right, well, I hope that wasn't the entree.
No, that was not the entree. I just remember seeing a picture of something colored.
All right, very good. Osi,
Yeah, I have a question. It's kind of odd, but, in terms of, new residents that come in, if they have pets, what's the arrangement for residents that have pets? If there are
I
any,
do not have a clue.
Okay.
I think people most likely need to make their own arrangements because you can't bring a pet into a nursing home.
Depending on the state, I guess, okay.
Well, you know what? I'm actually speaking with no, I'm gonna stick with my first answer. I don't have a
Okay.
clue.
Okay, is there, no, that's totally fine, I know I'm bringing kind of odd questions sometimes, so. Is there a way to find out if, what's the process? For, generally speaking, I'm assuming it's the state has, a lot to say about that. But I just wonder, curious about what's the process, unless Paul has any idea, but I don't want to put Paul on the spot for this. I'm just wondering if you can come back to us next month and let us know.
I can certainly ask about how we handle it. I don't know how much I'll be able to bring back, but I will gladly ask.
Okay, thank you.
My pleasure.
Sure. Where did he go?
I think he's making a phone call to Julio.
Oh, making a phone call to Julio, okay. Paul, do you know, do you have any idea how the state, if you want to add something?
Yeah, so it's actually, it goes under, and I actually know this because I used to run a senior center as well. So it goes under section 702.6 of the state law that you can't you can board one animal in a nursing home to be used under like pet therapy programs, things like that, but you can't have animals living fully. Now, there are some workarounds, I believe, if it's all short term. But you then have to worry about, other people's allergies, things like that. And in a nursing home, generally it's not ideal to have to worry about allergies on top of everything else. But the guide dogs, service dogs, things like that, obviously there's carve outs for those sort of things. But just a companion. I will say though that if it is a short-term resident, ACC does have some ability to help with potential fosters, short-term fosters, boarding, things like that. So, but if it's a long-term thing, it's pretty much going to go under the state law or the policy of the nursing.
Okay, because I know that there are some programs like that in Texas, for example, that
Yeah.
they do allow, I don't know about dogs, but I know they allow some cats in the facility. They're not owned by the residents. Those are cats living in the facilities and they allow to wander in any of the rooms unless the residents don't want them or whatever. So there are some programs that do that.
Yeah,
But
yeah.
outside of the
And
state.
that's the one cat or dog that is permitted in New York State. You're allowed to do that. But it's not, it's just one.
Okay. Okay, that's good to know. So Diane, we got the answer.
Thank
Yeah.
you. It's much
I just wonder.
appreciated, Paul.
Glad I could be here.
Yes. Yeah, I wish Steve could answer, if you could hear that, Okay, so, so now we are waiting for, well, we're really waiting for Steve because everything else is dependent on Sandra and Julio.
So honestly, if you don't mind, I do have something I just like to bring up. I could, if
Sure.
so the reason that I did pop on, other than I did have a great time with you guys last month, was yes, like I said, community board meetings are never usually this much fun. I enjoy you guys. So I just want to let everyone know that, while it's not in district, your district per se, we are opening up a new adoption center right next to the Manhattan Care Center in July. So it is a new, almost 3,000 square foot facility. It is taking the place of what was a one-story garage that was used for storage. And between DDC and the DOHMH, we've been able to transform this into what is going to be an adoption center. We have the ability to have about a dozen dogs, a dozen cats in that. So it's not a ton, but the user experience for the community to come in to do adoptions is going to be that much better. And that's 24 less animals that we'll have to actually house in the actual shelter, which will then open up space, which for those of you that don't know, we are in a severe population boom right now. So having that center open, it'll be a much more friendly experience for people to come in to adopt. So we're hoping that will help facilitate that. And like I said, it will open up more space in the shelter for those that need it. And then obviously also, in 2025, we'll be opening up the new care center in the Bronx. And next month, we'll be doing the grand opening of our new care center in Queens. So, we got lots of good things going on with ACC. So I'm happy to be here.
Paul, do you have the address of the Manhattan location that's going to be
Yeah.
opening?
Oh yeah. So it's literally right next door to the building that's on 110th Street. So the shelter's address is 326 East 110th, and that's between 1st and 2nd. The Animal Adoption Center is actually going to front on 109. So it's 328 109 between 1st and 2nd.
Paul added some information to Diane. I asked Diane, you missed all this, so I'm gonna.
Thank you.
Should I tell you what happened while you were making a phone call?
I made 2 calls, but yeah, go ahead.
Okay, so I asked Diane if owned pets are allowed in the facility.
Oh.
The answer, well, people are coming, new residents come in.
Right, okay.
And so, and Paul gave us the answer. That it's in New York State, at least it's not allowed.
Oh.
Unless it's a service dog
Oh, yeah.
or so forth, right? They have exemption. And Paul, what else did you say that I?
They can come for programming.
Yeah.
So they could come in like you could bring in animals for like dog therapy programs, things like that. Or the nursing homes are allowed to have one cat and dog that resides on property. But there's a whole other, as with anything, you have to certify, so there has to be a staff member is responsible, this, that, and the other thing. You have to have a partnership with a vet clinic to make sure the animal's being taken care of properly, stuff like that. But that is the one exception. You're allowed to have one cat, one dog on property, if you wanted to for residents.
Oh, that's interesting.
Yes, right?
All right, so all the residents would have to share the one cat or one dog.
Yeah.
All right, and that would.
It's one less animal out of the shelter.
No,
Trust me, if I thought it was a process that was going to help clear out dogs, I would be all over it. But I'll be honest, as someone who's worked in elder care and with older adults, while it sounds great, it's a lot more work for the staff. So it's difficult to get it to go like that.
Okay.
All right, and we show a real division among the residents as to which people are dog people and which people are cat people.
Right.
And then which ones are allergic.
Oh, yeah. Oh, well, put me in that category. All right, very good. Thank you. And really, thank you for popping in here as a surprise guest. Thank you.
You did tell me drop by any time.
Yeah, but nobody ever takes me up on it.
You missed it. I said that, I had such a good time last month. I said, I'm going to drop in again.
Oh, well, that's great.
I'm actually talking to most of the Northern Manhattan and the Bronx community boards about the new adoption center.
That makes sense.
And so you guys are the first. I kicked off with you guys. So,
oh, fantastic. Well, don't tell that to Board 11.
I will not.
Okay.
I am going to pop off though. So, but
very good.
Anything, if you guys ever need anything, just reach out. Asi has my email and anything like that, and I'll be more than happy to help.
Okay. And again, you have a standing invitation to come back whenever you want.
Thank you very much. Appreciate it, everyone. Thank you for all your good work. Appreciate it. Thanks.
Thank you for your good work. Thank you. All right. So I wasn't able to reach either Julio or Sandra. So I'm not sure what happened here. So I don't know. Why don't we have a discussion anyway? Because about the Cancer Plus building, because we're gonna have to formulate a position at some point, I assume in the near future, I don't know when this project is gonna be, referred to us by the City Planning Commission, but at some point in the near future, I don't know if it'll be in June or if it'll be after the summer, hopefully not during the summer. We're gonna have to, the board as a whole is gonna have to come up with a resolution. I assume the resolution will be, will come out of the land use committee, but, I think we should have some, input into it. And I'm sure that, Wayne would want us to provide some input. So, I told Julio the other day that I want to see the actual environmental assessment statement, because I want to see the details about it.
Get it?
No, but, it's possible that, the hospital sent us some material, early on. And it was one of those things where you had to have, it was a restricted access thing. It was on, this law firm's website. You had to go through a law firm to get to it. They gave us a code, and maybe is it possible that,
That's
that
kind of odd
it
because it
would
should be
have,
public
it would have
information.
expired?
I can double check, but I think last month when you sent this around, it wasn't working at first, and then there was an update and I was able to get in. I don't know if I still am.
Oh, yeah, that's what I sent it to everybody.
Yeah, you did.
Yeah, so I'm,
No, I think OC's right. It's supposed to be on the zoning.
yeah,
Website.
no,
Public info.
no, it should be a public document. It should be, yeah, you're right. It should be on the city planning website.
Right.
But I didn't look there, but Julio's here. Oh, very good.
Hey. here's
Man of the hour.
Okay, so Julio, we were just discussing the environmental assessment statement for the Cancer Plus building. Okay, you'll be able to forward that to me?
Sure, but it's not online as part of the whole package.
I believe I circulated the link at some point. Maybe
No.
it was in land use. I will find it.
Okay,
But if you don't, just, I'll definitely,
Yeah, thank you.
all right, because as I was saying, I wanted to read in detail, the various points that that Joe covered at our meeting last
Sure.
month. Because, the PowerPoint by necessity was a relatively brief summation
yeah,
of the various issues.
okay.
But so I do want to go, I do want to delve further into the sections dealing with water and sewer infrastructure, on noise during the construction, on the air quality, which is tied into the traffic impacts. And I don't know whether, I'm sure it doesn't include information on clinical trials, but one of the questions I do have is whether or not in some way this facility is going to make it easier for the public to learn about or gain access to clinical trials. Because would all the cancer-related clinical trials now be centered in this one building? Whereas previously, maybe they were spread around?
Yeah, I believe this would just be for basically outpatient, ambulatory care. The studies and this research was still centered with the university, which is not
Okay.
part of this,
Oh, okay. I thought maybe there was something in his presentation that, I thought there was something, that referred to clinical trials. Because I made these notes while skimming through the
So
presentation.
you want to basically see whether,
It does say
there'll
that.
be further information, easier information to access.
Yeah, whether somehow this new facility will provide easier entry into clinical trials. I don't, I don't, maybe this is now if you, it'll be easier to conceptualize that if you have a cancer issue, this is the place you go to, whereas maybe right now it's spread all around the medical center. I don't know. I was,
Well, that's a legit question. I'll follow up on the clinical trial and access to.
right.
The presentation says that one of the objectives for reorganizing the cancer care was to consolidate a lot of the service, and it includes ambulatory surgery, diagnostic and interventional imaging modalities, clinical trials.
Okay.
And exam and infusion.
Okay, so that's where I got it from. Thank you.
You didn't make it up.
I'll get you specifics.
All right. Yeah, let's find out how how it's gonna, what is the language there, Carmen? How it's gonna,
One of the objectives is consolidate a highly distributed array of cancer diagnostic and treatment programs.
okay, so
Which
So
include,
presumably, and that includes the clinical trials. All right, so let's get more info on that. Does anyone else have some want to add something to what we should be looking at in terms of this new building?
Heidi shared the link to the documents with me, so I can put up the environmental assessment if we want to look
oh,
at it
that'd be
together.
great.
All right, so why don't we, I mean, I'm sure it
It's
must,
300 pages long.
Oh, yeah. it is
oh,
300
I was gonna
pages
say it was
long.
1,000. So,
I don't know if you're looking for something specific in that I can hone in on maybe.
Heidi, can someone send that to the rest of the?
Sure.
Yeah.
committee, please?
All right, so why don't we all spend some time looking at it between now and the next meeting? But I'm particularly interested to see what improvements are gonna have to be made to the local water and sewer infrastructure to accommodate this building. And whether you know, do we have, whether there's a commitment from the city to upgrade the water and sewer system to as a result.
And electricity one, while we talk about it.
Yeah, and electricity, yeah. Well, you know, I think Con Edison can handle that, but then it's a legitimate question.
Yeah, Steve, the thing is, to propose to this building, cancer building, why can't we propose to New York Presbyterian to make self-sufficient way to make medical products that are made in America? Why are we, today I'm walking by these N95 masks that are coming. Why are we wearing Asian products on our faces? Why are we not investing back in the American mask? I wrote FIT this week and I brought it to these protesters. We don't have time, obviously, we don't have time to read this out. I have it in my pocket right there. I gave it to them.
Well,
Why are
that's
we not-
that's actually an issue that I think that Biden was pursuing.
But I mean, I'm just saying,
That's-
as far as like
Good.
spending
We were-
billions
we
of
were
dollars
sup-
in this cancer facility here.
Yeah.
Why are they, look at what they're doing in this facility right here where we're sitting right now, in the libraries. I went to church today. Well, I mean, it's not your responsibility, Steve. I'm not gonna place you on spotlight, but let's go to these facilities. Let's get Eric Adams. Let's get the people that are at the point to come down to the base and see what's going on. So then you know these admissions would then lead to this $4 billion investment. Sorry, I'm off the numbers of this building. Why are we not investing back in something that's at least gonna be manufactured in America, not having China?
Well, that's that's really a national issue. It's I
Right.
can't pin that on the hospital,
Yeah,
but it is something I believe that the national government is focusing on. And I think I do remember that I think it was Biden. I don't think it was his predecessor who was talking about developing capacity in the United States.
Right.
Because we didn't want to go into the same issue again where we had to beg all over the world to get masks.
Right,
Yeah, why don't we make our own mask here? in
Right,
America?
no, of course.
right, but that is on the federal level. It's not
Of
something
Of course,
that the
but these
hospital.
issues are gonna keep stemming up on the federal
Yeah.
level. There, I wasn't allowed into
Yeah.
a January 31st, the state of the borough meeting, because I was not vaccinated or because I did not have a negative COVID test. I was not allowed in Sherman Hall at City College. This is unacceptable. All these issues are federal. Every night that I'm here, every night all over the city, all these districts, everything is federal. We need to stop hiding behind the federal government's ability to not address sexuality, not address the ability of the drugs that we're putting in our body and these emissions that are currently, well, existing right where we are. So
Okay,
why are
Ryan,
people
okay,
in that-
Ryan,
I don't mean to rant, but it's
we hear you. Okay.
it's just, but it's just hybrid, with the hybrid too, Steve. It's irritating, Steve.
Well-
You want people to come in and be a part of it, but then you have to deal with this hybrid, and now the people that have Zoom get more presidents than people coming to facilities. This is not how you do this, Steve. You gotta reward the people with integrity for coming in and putting your heart in the building where you are. You're always here, Steve, so I'm trying to tell you.
Well, I'm not
I
always
wanna
here.
comment you and everyone that's here, you are putting your time into
Yeah.
this. So trust me.
But I tell you something, I'm not gonna, I am not gonna, discount the need for people to be vaccinated.
Right,
And that is a absolute need and people
many-
who are refusing to get vaccinated at a time when it was absolutely necessary were doing the wrong thing as far as I'm concerned.
Yeah, because the vaccines are companies, Steve.
Well, I don't care what they are. And in this case, companies were doing something that was good.
No, you were putting.
And the reason today that hardly anybody is being hospitalized and at this point, nobody is dying, is because the vaccines are working.
Steve, how many people got vaccinated in New York? We don't know. How
No,
many
we
people
do
got
know.
vaccinated?
No, we do know. We actually have numbers. The health department was keeping track. And then, and in parts of Manhattan, 90% or more were
What's the
being,
population in New York City, Steve?
overwhelming numbers were being vaccinated. In the citywide, that
They just held information on the
91%,
fact, Steve.
91% of the people got at least one shot. They got at least one vaccination. 81% of the people got both shots. So the overwhelming majority of people took the vaccine and did the right thing by getting vaccinated.
No, the United States government withheld information on the design.
Oh,
You couldn't do
please.
the vaccine
Okay,
until
but
you
it
do
worked.
one United States
Ryan, it
government
worked.
vaccine.
They,
I think
Ryan.
it's irresponsible. I
Okay.
think it's
Okay,
irresponsible.
Ryan, really, that's enough.
I think
We've
it's
heard you.
irresponsible for really for the sake of people that can't take the vaccine because of medical issues. And so it's irresponsible to sit here unvaccinated and you don't know who else is at risk right now in this room. So I really don't think it's responsible to sit here unvaccinated, even though it's your right. But I have to
So what
voice
company would you suggest that I put inside
You
my
are talking
body?
to me about two different
What
things.
company would you?
I
suggest
don't
put
know
in my
about
body?
company.
Wow.
I don't know about it. That you
Well,
should
with
take
Irma,
with your
Pfizer,
health
or
provider,
Johnson,
not with
Which
me.
vaccine did you get?
No,
Which
we're not
vaccine did
going,
you get?
okay, I'm gonna
Okay.
stop it right now.
Okay. All right, let's move on.
Well, you said you felt uncomfortable with somebody unvaccinated in the room,
Okay.
so then what vaccine did you?
All right, listen, Ryan, we're off that topic now.
That you felt-
So I,
Old business?
uh,
wait, no, hold on.
so are there any other comments?
I have a question.
Yeah, go ahead.
I was very curious, especially now that I'm learning more about Presbyterian, about how they were paying for the building, right? And he was very reluctant to share,
Yeah.
but it's public record. Like I could look it up afterwards,
I
you know, during the year that the
Yeah.
expenses are filed. But I was curious, you know, why would they be so against sharing that information?
I
Has
don't know.
that happened in the past ever? Like,
I don't think so, but I agree with you. I don't know why it should be considered a big secret.
because
and-
the reason I asked was because I was just concerned if they were removing funding from other programs to fund this. So I was just curious as to
Well,
the
Where the money's
structure.
coming from?
Yeah, where the money's coming from, because if it's $1 billion project, like where's that money coming from? Besides that, they're also pledging 1.3 to the communities. So I was just curious as to, you know, where the numbers coming from, and they were so reluctant.
All right.
What was the 1.3?
On the presentation, they had like a pledge. It says like 1.3 billion a year to community programs. I think it's like on, it's on one of the pages.
Well,
I'll find it. Back this up.
I doubt whether that's any kind of new money. That must be the total value of the services they currently provide, maybe.
1.3.
I think referring to, I mean, first of all, the building this project and of course, we also have other projects taking place. These are not funds that are going into specific programs or services in the hospital. These are funds that are raised through our development office, which is phenomenal in terms of raising monies. And we have an exceptional board who make a lot of contributions, who pledged towards the campaign, which is really a campaign for infrastructure for the building projects. None of this money is taken away from any of the services that's provided to the community of the hospital. In terms of the community programs, that we say pledge, it's not really pledge, it's money that when the hospitals, for this operating budget, they allocate monies to support some of the community programs. And then other funds then also gone through grants, either through the state or the federal government to provide some of the community programs.
But that's what I'm saying. So if that information you're sharing, and every year is public record, why not share?
Well, we have a nine.
Yeah, exactly. So why not share the budget?
Yeah, well.
Because if there's, let's say, for example, there's like 400,000 or whatever, 4 million, whatever amount, 400 million dedicated to construction.
Yeah,
you know, like
but it's easy.
that way we could be like, hey, you know what? Hire within the community, like they're creating jobs.
Right.
So if everything is public, and even like the entire board is public, their salary, everything.
But you
right?
know-
so why hide the budget for the?
I can come here and tell you today that building is gonna cost $1 billion, right? Today, the building's not gonna be built today. it's gonna take a number of years. So the numbers that I'm gonna give you now, most likely is not gonna be a number when
That's
it's
okay.
when it's actually built.
But is the,
So
It's
he
a
did say, but he did say it's gonna be in the billion. It's gonna be
He
over
did
$1
say
billion.
that.
But why not share the
You
budget?
did.
Or share
But-
the funding sources?
But I just mentioned funding sources.
Yeah, but that's you're not doing that in writing as a
Well,
public press release.
has the money already been raised?
I think most of the money, was raised. And, we also had a nice endowment that, a gift from, Dr. Herbert, Irving, oh my gosh,
Urban Urban.
Herbert Irving, who also gave a substantial, donation to both the hospital and the university. That will go to.
That
When you
was
say the
great.
university, you
Oh,
mean Cornell, Columbia?
No, Columbia,
Yes, that's
yeah.
what happens.
This is all great. I don't think that we are, looking at that in a negative way. It's all great, wonderful, if you can raise your own money, wonderful that you may not need as much grant. I mean, actually, no, grant is
There's
only
no
for
grant.
running, right?
There's-
But it's all good. I don't think there is like a negative thought about behind that, and just question of like knowing. That's all it is. It's just knowledge. So why not? If you
Well,
already know, if you raise most of it, then you have a more or less number.
Yeah, but again, I don't think any of the projects that at least the hospital where I've been on has given, this is how much it's gonna cost.
But it's
I
actually
think-
good to
I
know.
think it's giving a ballpark in terms of what it may cost, but not in terms of what was the actual cost for this building. And I'm, again, I don't know,
Is this something that gets reported in the 990?
I'm not sure, I haven't really looked at the details.
It had to be reported somehow.
They report the expenses for the year. So let's say if this year they spend, 200 million on this, like yearly,
Yeah, but
but it's very
but it-
vague, it
but are
is
those-
grouped.
are those operating costs or would they? Would it
Yeah, we
also-
won't be able to determine.
You
'Cause
can't determine?
No, because they'll have like an income statement, but everything's aggregated. So it might be like, this year we made, $1 billion, but we spent 900 million. Then, it's all public record, like the numbers are there,
Okay.
but it doesn't discern. That's why I was asking for the budget. And what really stood out to me was that the gentleman was very reluctant. Like, it's public record, like we could, eventually, there's gonna be information regarding how much was spent, how it was spent, where the money came from. And
Well,
I
maybe
appreciate what you're saying as well, but it's different when it's in writing, and it's like, hey, listen, Presbyterian, this is a press release, it's $1 billion,
Well-
and the funding is 30% private, 20% grant, or whatever the case is.
Yeah, everything, there's no grant money, there's no loans, there's no, subsidy, that's being, given to the hospital for this or any other project.
I
These
think
all- these
like
all monies have been raised.
the hospital is a really important part of our district, and I think from our perspective, the most transparency you can provide, the better. I agree with OC that it's not like we're looking at it as a negative way or that we feel like we're entitled to it, but the more transparent that the hospital can be about what they're doing and the investments they're making in our community, I think the better, right? That's my opinion.
If I could raise $1 billion, I would want to brag about it. I would want everybody to know that people have such great confidence in this institution that they're willing to donate $1 billion or more dollars for this new building. I would want everyone to know about it. And so I wouldn't want to keep it a secret at all.
And more power to you that you can raise it. This is
Yeah.
great.
That's expensive.
I mean, yeah. Well, that's, maybe you could carry that message back.
Yeah, but again, I understand the transparency.
Yeah.
You wanted to know the nitty gritty, all the details, what are the investments that are being made? I think when you look, when you go to hospital, and you look at, some of the changes, some of the improvements. I think that, we should gather that and say, well, it's being done. I'm not sure in terms of, and even coming here and reporting, this building's gonna be, it's gonna be constructed, this is gonna be contained. I think that's an important part of it. I'm not sure how important it is to learn, well, how much is that gonna cost? Whatever it's gonna cost, we're gonna raise it. What the figure is, we don't know at present, how much that's gonna be. But
Well,
we're moving forward.
Then tell us when you know what the video is.
But I think it was really good. He said it's gonna cost, at least $1 billion.
Yeah, I know, yeah.
I think Elvin raised a really good point that you did answer, which was about where the funding was coming from, like if other services were going to be affected. What I heard you say, and I'm repeating just so that I'm make sure I understand, is that this is specific funding allocated for buildings that's not coming from reducing other services, because that was the concern of mine last meeting as well, where we're moving all these services from different buildings into this new building once it's done. And I wanted to know what's being done with that extra space, if there were going to be new services moved into that space. And it sounds like that wasn't answered very clearly. So I don't know if you have any more on that, but I think that's where a lot of the funding questions come from, is understanding, will there be any changes in services? And especially since we've had, lots of back and forth about transparency around services and changes in services. I think that's where all this comes from. I don't know.
Yeah, that's a good point.
Yeah, I agree.
But in terms of issues directly related to this new building, Jody?
Well, I just wanted to ask, I mean, when I looked at this impact statement, it's an environmental impact statement.
Well, it's an environmental assessment statement.
Okay, environmental.
And an
assessment.
environmental impact statement is a much more detailed, is a much more thorough analysis based on an initial determination that it could have a negative impact on the environment. So they're then required to do a more full-scale study. So an initial determination was made in this case that there wouldn't be a significant, I think that's the word that's used, a significant negative environmental impact.
So they didn't need to do
They didn't need to do a full-blown environmental impact statement.
Can we address things outside of this impact statement as well, or assessment?
Well, go ahead.
Okay, so again, I'm gonna I threw it out the last time, but I'm gonna throw it out again. First off, I'm excited about this state-of-the-art cancer center. I think it's gonna be amazing, but I can't imagine that it's not gonna bring in more traffic.
Oh, I agree.
And I do think that this, I mean, maybe they're saying no, but is there any concern?
Well,
Do we have any concern about just general admissions from the amount of cars coming in? And then I really do think that we need to look at a traffic survey, because already we have a significant problem at Fort Washington and 165th Street. We had an EMT person come to Traffic and Transportation last month and said that he's having a very difficult time getting his ambulances into the ambulance bay because of the significant amount of double parking on 168th Street. I've talked to two doctors recently in the last month that one said the most stressful part of their day is parking at the garage. The other doctor said that he actually monitors his when he leaves his home in Westchester based on the traffic at 165th Street. And I think these are all serious concerns that we do have to take into consideration if we're building a new 440,000 square foot space.
Well, this is one of the reasons I want to take some time and review the EAS, because I want to see what the section on traffic.
And tell me, EAS is the
Environmental assessment statement, because I want to see how did they come to the conclusion that there would be no particular negative traffic impact. So I want to read that section.
Well, it seemed, yeah, and I agree with you because I haven't looked at it and I'm not that familiar with this. You are much more familiar than me, but it seemed like they related it specifically to emissions. But I also think it's traffic flow.
Yeah. Well, I tell you what, your homework for next month is to make sure you at least read that section. If you don't read anything else, read the section on
papers. I'll have to figure out.
Say one thing, to that, when we look at the building, the idea is we're not looking to expand considerably any of the services. What we're doing is reshifting from one place and bringing them all together under one roof.
right.
So,
But you're bringing them together at 165th and Fort Washington, where there is already a great deal of traffic problem.
for example, if you drive and you are going to drop off someone at 168th Street,
Right.
presumably if you're driving, you're still going to have. Just imagine how you're going to get to 168th.
Well, maybe maybe you're coming from the north. Maybe you drop someone off at 168 and then you go
and you
off
still have-
168th Street to
you still-
Broadway. Now you got to go to 165th.
you still have the traffic, the same sort of traffic, because with the
Well-
traffic at 168th Street in the
Yeah.
morning, for example. It's almost equal when you go on Broadway heading south. There's a lot of traffic. So first of all, so there isn't a great volume of patients you're gonna add to this. But when we look at the issue with traffic
But I
flow,
think, I find this hard to believe. Don't you want to be able to serve more patients?
Well,
Isn't it,
if-
that's really not part of the impetus for the project?
I think the focus is to have a state-of-the-art facility
Yeah,
where you can bring all these different cancer services together under one umbrella.
right.
So that it makes it easier for the patients to be able to navigate and get. the
But if
services.
you're providing,
Now-
if you're
now-
providing a much better environment where people can be treated, more
Well,
people are likely to come.
But-
More people are gonna wanna avail
Are you
themselves
going to
of this
expand the
service.
number of infusion, pods
I don't,
for what you have now?
I don't think he said that, but
I'm
But I
asking,
think,
I
but
don't
I
know.
think that when you look at the traffic.
Yeah.
I mean, traffic at Fort Washington and 160th Street has done, I think, maybe when you went to city council. Steve. I mean, it's always been a really difficult problem. And to be honest with you, and we've seen this, when you have enforcement, it becomes a little bit more easier. Traffic flows
easier.
traffic flows a little bit better. And we also see that when when the hospital hired, worked with the city and hired the traffic agents that are there now. It does matter in terms of the enforcement aspect of it to get traffic moving a little bit more. We're hoping that not only these officers that are there now, but when security hires additional staff that would be able to manage the traffic flow on the upper part. And they're also working now with the 30th precinct for enforcement itself, not just let's have cars guide these cars out, because you have cars that don't move, they don't care, they don't move unless you physically gonna give them a ticket or something. And hopefully when that starts happening, the traffic flow would would improve.
Where are these traffic officers located and what are their hours?
They're on 165th Street from 7 to, I believe they're 7 to 7 for Washington Avenue and 165th.
I think
I saw them the other day, yeah, they were doing a pretty good job.
I
Of
think-
directing traffic.
Okay.
And also, I think when the building is built, I guess from the design, there is gonna be a drop off section inside,
Yeah.
so.
People are not double parked.
Double park. I mean, right now, you also like when you have people that were going to the Eye Institute, there was a small sort of circular driveway that was, created sometimes own problem because you wanted people to go in and you have other people trying to go through and it just, created a blockage. So hopefully when that building is built and you have this, additional sort of drop off, that would also help in terms of the traffic flow.
But the problem with enforcement, when we're looking for more enforcement, is it's not that the number of officer on the 33rd will suddenly increase to accommodate. That means that there will be enforcement here, which will be taking away from enforcement from another area. So now we are creating potentially problem in other areas that now being enforced. So we are just shifting the problem to another area. We are not solving anything.
Well, I don't know, are these officers coming from the 33rd? The hospital is paying for them.
Yeah, but the one we pay for, these are now officers who are on duty.
Yeah.
Right, but they're not giving tickets.
No,
Your
the officers that are current now, the traffic agents. They don't, I don't think really traffic agents really.
Right.
these days-
These are traffic enforcement agents.
Yeah,
Yeah, they're not actually police officers.
right.
Yeah, but
Um,
they can give tickets.
Yeah, well,
They don't get.
they don't give tickets.
No, so what's the point of having them then?
Well, I think that,
I think
I think Jody mentioned
they're-
they've been very effective in terms of guiding,
Well,
guiding traffic.
they have a uniform.
Well, that's.
People don't realize that they don't give tickets.
Now we tell everyone because we are online. Okay,
Okay,
The objective is not to penalize these drivers. the objective is to get them going,
Right.
you know?
I have a question. No, there's no extra garage space in the building, right? Like an extra.
No, no,
parking,
no.
Okay.
All right, any other?
Oh.
Yes,
Did the city had a negative declaration on the EAS or not yet?
I've been.
I don't think it's, I don't think they've rendered an opinion yet, because.
Yeah,
Oh.
not according to the website.
Not yet,
Because, yeah,
okay.
because that would come at
It's,
that would come at the end of their review process.
yeah.
Which,
I have one last question. What was there before?
the Eye Institute, it's, the building is still there, has not been demolished yet. And what, is it a three?
It was probably there was some Columbia space, I guess, for research, but there's also, it was more dedicated to vision care. Yeah, so that's why they call it the Eye Institute.
That was owned by Presbyterian as well?
Yeah, it's a built, yeah.
Yeah, well, that's why they can, that's why they can demolish it, because they own it.
They've already started on the inside.
Oh, yeah, I think you're right, yeah.
Yeah.
But it's a low building, what, 3-4 stories, or
No.
the Eye Institute?
Yeah. The Eye Institute it's maybe like 8 floors. maybe?
Oh, is it really? Oh, okay.
Even 9 floors, yeah. Because the building next to it is we put the service building.
Oh, that's, yeah.
It's that's 6th floor. and
Yeah,
this-
yeah.
This is much bigger.
Right, okay.
Yeah, you just don't look at it because again, the slope.
Yeah, okay. No,
The slope.
I have bad eyesight. I should go to the Eye Institute. And anything else? All right, so we're gonna spend the next month reviewing the EAS. All right, very good. Julio, do you have a regular report to give us?
Not really report, but just a couple of things. One is, and I think some of you may have worked, I know Steve has, have worked with them, for a number of years, but our former president and CEO was Dr. Herbert Bardis.
Yeah.
Unfortunately passed away, a couple of days ago. He was up, he's been up here for a very long time, not only as the president and CEO who helped really with the merger of New York Hospital and New York Presbyterian. But he was also before that the dean of Columbia University of here.
The medical
Of
school.
medical school.
Yeah.
For a number of years, and that's why I know that Steve worked with them at both sides of the inn for a very long time. So he's a great human being. I mean,
Yeah.
He's a great person. So he was definitely missed.
And I tell you, it was good to be able to work with him. You really had a clear sense that this was a guy who was community minded, who somebody you could talk to. Can't really say that about his successor, but I really feel as though he was approachable, and he was a very good guy.
I must say, I mean, to no fairness, Steve, even the current CEO is very community minded. It may not be feel that he is open, but I would differ. I would argue that they do have that same sort of community mentality to itself.
Well, it somehow was easier to talk to Dr. Parties. And
But the other is, so I circulated to you, Steve, a mental health event that's taking place at PS4
on Saturday,
on Saturday.
That one out.
Oh, great. I hope that people could come.
I think at your direction, I believe I forwarded it to all the committee members.
Wonderful, great. And then finally, going back to construction, because I know this committee is heavily involved in dealing with noise. I also want to bring to your attention that we also have a garage on 160th Street between Port Washington and Riverside Drive.
Right.
For quite some time, the garage had been closed. Shortly after the incident with the garage on the 33rd Street where it collapsed. So this garage on 160th was closed. So, look at it and evaluate and see what needs to be done to ensure that it's structurally sound. Some months ago, about 100 cars were allowed to come back in, back into the garage. However, there are structural defects in the building that needs to be repaired. There will be a 1-year to 2-year project that will take place to We have that for the garage, and it'll be done in sections because it's some employees are still using it, of course. So as part of the, construction, there's noise, and issues that may come up. I want to thank Jody. I did mention this to Jody, when I first learned of this, including to a few other people around the area. I want to again thank Jody because she also reached out to a couple of other folks, some tenant associations, about this. We're going to be putting together a notice for the residents in that area, with contact information. We are thinking of trying to put together a meeting with some of the tenants association that are adjacent to the building to fully explain what is happening, what's going to take place, how long this project is going to take. And then if they have any concerns as this project goes through, someone they could reach out to and speak to ensure that whatever problems come up, it will be remedied, quickly. So,
Are you in touch with, Councilmember Abreu on this?
I advised, also, Sean about it.
No. 'Cause, he lives right around there too.
Yeah, he lives near the Lawrence. Yeah, so I did, Jody gave my number to, I guess, one of the tenant leaders that's next to the building, so we want to make sure that.
What's
we keep
it?
in touch.
I think of this as being a relatively small garage.
It's probably like 3 stories, maybe,
Yeah,
three stories. I'm not sure, I'm not sure what's the capacity, but it's a fairly, it has a nice footprint.
Oh, really?
Yeah.
And it's busy.
And
When
it's
it's
busy,
full,
'cause-
it's
yeah,
busy, it's
yeah.
busy, yeah. Now Janine's a good person to know because she sort of knows everybody on that street pretty much and she can sort of.
Yeah,
Yeah.
I think it's
Rally the
important
for-
for
rally
folks
the
to know,
forces,
and, it's important for them to have someone they can reach out to in case there's issues.
Yeah, she was really happy to talk to
Yeah,
you.
so.
Good job, Jody.
Okay. It was.
Well,
I'll let you do the connection.
Jody's the connector.
There you go.
Jody's the connector, so much appreciated.
all right, anything else?
That's it, 3 points,
You had 3 points?
3 points.
Oh, good for you. We were taught by a guy who always told us to have 3 points.
Three
That,
points.
that was the magic
Yes.
of doing some kind of public presentation. You should always have 3 points.
And when it talks about politics, it's
Yeah.
city, state, and federal,
Yeah.
3 points.
And actually, I found, I was cleaning up my house the other day. And, I found an old, newsletter about him.
Oh, really?
Yeah, gone. Okay, we're on to old business. Under old, we have street sidewalk cleanliness ratings. Nothing new has been, posted on the Office of Operations website. So there's nothing new, nothing has been posted since November. So there's nothing new to report on the sanitation website. There are new statistics for January on, curbside and, refuse and recycling collections,
January?
for January of, the latest month, 2024, January 2024. Last month, I think I gave you the numbers for December. And it looks as though there's been a slight improvement. Oh, actually, Julio,
Yes,
speaking of money for the hospital, there was a notice printed in the paper the other day, that the hospital is owed some money, by Aetna Insurance. So, you should collect it.
I should collect it. Can I switch that in terms of the name? Collector?
Yeah, pass it on to your finance people.
More money for a building.
Well, no, I don't think so, because this is probably.
You know, President of Brooklyn?
And there are a couple of addresses on 168th Street.
Yeah. There's something.
Okay, so where was I? Oh, yeah, on recycling.
Mhm.
So, where's that?
Recycling for January.
Yeah, so in December, we had a diversion rate of 16.5%. And in January, it went all the way up to 16.7%. So 0.2% increase between those 2 months. Which I tell you, makes no sense to me, because you would figure that with Christmas, people would have all of these boxes and wrapping paper and plenty of stuff that could be recycled. But I guess maybe the overall waste stream is so much larger that the recycling portion, doesn't really stand out. So, there was a slight gain in our numbers for January. And there are, I didn't get a report from, DEP. Is there, we'll end on old business.
Yes,
I
was waiting for this.
Wait one
Can
second.
I ask you a question?
No, you're out of order.
Oh, okay.
What's your question?
When you speak about recycling, and, you know, some of the community boards have done these, shredding events. But bring it.
Well, I tell you that, I think they're usually done by elected officials.
Yeah.
So, but I've seen them done in conjunction with community boards. I think the last one might have been community board 10,
Really?
some of that. So, I'm throwing out there is because this being the environmental committee.
Yes.
I'm not sure if that is something that this committee like to spearhead along with the board, as part of the board. And we'll be more than happy.
To sponsor one
To
or two or three?
collaborate with this committee.
There we go.
Not a bad idea.
Mhm.
Not sure where the shredder comes from. We should find out. Maybe it's from the sanitation department.
How does that work? I'm not familiar.
Well, in terms of we, for the hospital, for example, we use a shredding company because of the sensitive information. And so we use a vendor called, I think we should be called Shredded.
Yes,
I'm not sure they were part of Mine or something like that.
Iron Mountain.
Mine. So we would, that's what we use. So, and I think that when I see other events, I think they've used the same companies.
I think
So
so.
it's like we invite the community to like shred.
So yeah.
It's a big truck and you throw your stuff in and it gets shredded.
Yeah, yes, you invite the community, you have, documents, you bank, financial records, whatever.
Right.
You wanna get rid of, you wanna bring it in, it's shredded.
Do
Yeah.
you get the certificate that it was shredded? Because depending on what kind of material is shred. If you ask for a certificate, will they give you?
A certificate?
Of course. They, what you're using, you get a certificate for sure. That that you shred material because it's a private information that they're shredding. There is such thing, I know, because I did it for whatever, I know that there is such thing, but I wonder if if the company provide the certificate.
Well, if there's such a thing, yeah, I'm sure we'll
There
get
is such
something.
thing.
We should.
I think it's a great point and something we should definitely look into. But it also makes me think about, I know electronics recycling has historically been a really important part of this committee, and we haven't
Yes.
talked about that in a while.
Yeah. my God.
Also, like, just as a young millennial, I know I have more electronics to recycle than I do papers to shred, but that's just me. So
Oh,
we
God.
should look into that as well if we.
Yeah, we forgot all about
Yeah,
that.
The batteries.
Yeah, the batteries. Like, I have so much junk that I need to get rid of.
Yeah,
Same.
I was looking into this recently and you can take stuff to Staples. But like, I think there's only one Staples on Broadway.
Like 184th. Yeah.
Yeah, we sponsored, with the Lower East Side Ecology Center, we've sponsored electronic recycling events up in Inwood in the past, and they're usually unbelievably successful.
Right,
Have we done one in Washington Heights?
there was,
We did one once at 175th Street. That didn't work out very well.
Hmm.
And then we were, when Sally Fisher was on the committee, we were debating to come up with another site in Washington Heights, and we never really settled on one.
So why not utilize like Audubon Avenue or 116 right in front of the board and just have it closed off of, an event, highlighting the board and, committee and have these shredding or,
Well, I
you
think,
guys have an event, Columbia has the event on 120th. Twice a year. Like toxic material, like, paint and blah, blah, batteries and you name it, and I think shredding is including in that. Could you find out for us if maybe they can come over at least once a year in our district? Cause who's gonna track down stuff to 120th?
Yeah.
Yeah.
You know which event I'm talking about, right, Julio?
I recall something that they.
there's the
The
university.
Morningside campus used to do.
Oh.
Okay,
Yeah,
yeah,
so I'll find out.
okay, that would be great.
I'm not very familiar with it, but I could call someone.
Because if we could do like one event run by Columbia, and then we have other events as well. That wouldn't be a bad idea.
No, it's-
Something during the summer, I mean, when it's, people can schlep things, walk, ideal time to do it.
Yeah.
I know the board takes a hiatus, was July and August?
Yes,
yeah, but
but still,
we still have staff, we still,
we can run something.
we're still, we're still alive and kicking.
Yeah. What about the other recycling question? That I always like.
Well, the one that, where I wrote a letter to the Green Market lady, to ask her why we don't have textile recycling.
Yes.
That one,
Mhm.
but I only wrote to her today, and then I said, if you have an answer, please get back to me,
Okay.
before tonight's meeting, but God knows when she saw the email. So, I don't,
Excuse me.
I don't-
Also, Steve, when we did the sanitation foundation camp, something came up with all of these. The recycling, the textile, the electronics, paper shredding, and, I just don't remember exactly what the details were on that, but.
I think I have that information. too.
Remember that?
Yeah,
when we did,
it was one of the modules.
what
But
was it?
I'm happy to look into, I took a lot of notes on it, so I'm happy.
Oh, you went to a separate,
We
a
went to
section.
the,
We were part of
An
the
eight,
Senate.
an 8-week session.
Yeah.
we all- and
Oh,
yeah,
the,
we
oh, the
all-
three of you,
yeah,
oh,
And we.
It was
we
really
learned a
great, by
lot,
the
but-
way.
But I just can't remember anything I learned really, so I have to go back and look, but there was some details on all of this.
maybe we
In
can
that-
get them involved.
yeah,
I'll look into it and
great.
find out
Okay.
what,
and there's, so,
what
so there
I
might have
learned.
been information there on how you organize a shredding event?
Well, I think it was like, what I recall, and correct me if I'm wrong, guys, but it was all different places that we can go.
Yes.
If we have electronics to get rid
Oh,
of,
yeah,
if
yeah,
we
yeah.
have paper
Yes.
we want to shred,
Yeah,
if we
yeah.
have textiles we want to
Yes.
recycle. And I just, don't
right.
remember, I have it written down somewhere,
Okay,
but
but
let
I-
me look into
look into
it
it.
and find out
But-
what I.
Okay, but I think our objective is to,
Right.
make these things more convenient for people to access.
Exactly.
So,
Make it more
addition-
convenient and if I'm not, if I'm correct, like even letting people know what exists out there.
Exactly.
Mm.
yeah, okay, yeah, they're
Yeah.
not, they're
Yeah.
not mutually exclusive.
Mhm.
All right. Any new business?
I have a question, and I'm not sure if it pertains to us, but at the general board meeting, there was a lot of individuals that were very passionate about like the turf. Since we're environment, is that something that we should just in general be concerned about? Like the park situation, like does that apply to any other areas in our district that we should be concerned or?
Well, the synthetic turf, as far as I know, only exists in parks, that, in terms of this community, well, probably anywhere else maybe, but, I mean, to be honest, of course, that puts me in a somewhat difficult position. But I mean, it's legitimately an issue for the Parks Committee. And it's unclear to me what the environmental hazards are. I mean, we've had synthetic turf in many of our parks for years and years. At least 20 years, if not more longer.
And then just, if I could add just one last thing, the second one, with the, I forgot the term. The initiative to control traffic downtown, what's the name?
Congestion pricing.
Congestion pricing, yes. Any thought, especially now, like, discussing, like, can we even like pitch something like that? Like, hey, there's too many cars up here. Like, is that something that we have the ability to like?
Yeah,
look
something,
into?
we should look into that because, and we should ask We Act maybe to talk to us about it. We Act, I believe, the Environmental Justice
Mhm.
Organization, I believe, has a grant to do some kind of a study on the impact of congestion pricing in northern Manhattan. And, I'd like to,
Especially here because it's the right exit from the George W. Bridge.
During the pandemic and shortly after, there were so many paper plates and so many new vehicles being purchased. There's a lot of, especially the younger generation, they're buying vehicles at a young age. There's so many new cars and Dykeman and Inwood and even Washington Heights is just flooded, double parked everywhere. And I've seen like a new influx of new cars. So I was just curious, like if there's anything we can.
no, that's a legitimate concern. We should be trying to see how it's being tracked. Yes,
On the same line. I gather, there's a lot of talk about doing price congestions. First city in the US to do this. Other cities have done it. However, I think that other cities have also done it in conjunction with permitting. So that, you have an area like South Sixth Street, we have to pay, but then north of that, it's open, in its open city. So I think other cities has also done that. You're gonna park near the border, there are permits that would be required or given to the residents of that community.
Yeah.
So they'll be able to park as opposed to someone coming in from somewhere.
Resident parking you're talking about.
yeah, residential parking permits.
I wish.
Well, it would discourage double parking,
Especially because of all the cars coming from Jersey and,
from
Yeah,
their
and
place.
parking in our.
yeah.
passer by.
I mean, and I know.
Well, I tell you, the
that,
problem with that, however, is that there are a lot of people who actually live in northern Manhattan who somehow have like New Jersey plates, right?
But
That's-
that's, they then if that's the case, listen, if you live in Northern Manhattan, that's where you register, your
Right,
address is.
right,
You should register there.
Right.
right.
Well,
Well, actually, yeah,
So,
you should,
so money that's
yeah,
going away
right, you
from the
should, yeah.
state,
yeah, you shouldn't get a free ride if you have,
right?
if you have an
And
illegitimate
it just,
license.
and probably caught me in it. I've seen when I visit, there's residential parking that's coincides with price adjustment.
Really? I don't know. I don't know if I've seen, I mean, I know that, there is a bill pending in the city council, is it from,
Right.
Levine put it in when he was in the city council, maybe? And did Carmen De La Rosa take it over, maybe?
I think that's, I remember there was someone,
I-
Gail, was it Gail?
I don't think so, no.
No?
Well, he had, so, a couple of other council members, I think, including Carmen, were recently quoted in the papers, pushing residential parking permits.
Yeah, yes, she has, I just Googled.
Yeah,
She,
okay.
yeah,
There is a lot of benefits to have that. One of them is actually the money that's going, like the licensing, the money that goes to the state as opposed to other states. This is one thing. And also when we had the inward rezoning, the DOTs indicated we don't have as many cars in our district. And I was like, wait a minute, you're not including the one that are not registered in New York State. And it's an issue by itself, but that means that their data was incorrect. So that's it's a problem, but that's the, traffic and transportation will have to address that.
Yeah, right. But let's also, there are environmental impacts possibly
Correct.
from congestion pricing as well that has Elvin
Yeah.
raised. So we should look into that.
Yes, we should.
Yeah, because the Bronx is getting a lot of money.
Right.
Because of the added
Right.
fumes. And
Yeah.
I'm like, well, they're gonna get money in the added fumes.
What about us?
What happened to the folks that, what happened to the, Manhattan?
Yes,
You're gonna get it even more because people are gonna be driving in circles north of 60th Street. looking for-
no, yeah, and I assume what they're talking about mostly is added congestion on the Cross Bronx Expressway. So how are the cars gonna get from Jersey to the Cross Bronx without going through Manhattan? There's I don't know why I never even thought about this. Why hasn't anybody been raising that issue? Why aren't they really also talking about increased traffic running through Manhattan?
There is. I'm not a part of the committee.
And then we're gonna have 2,000 residents coming into the new developments,
Did you say 2,000?
or is it 4? How many? I
More.
don't even
More
know.
like 5-ish?
5,000, yeah, and I'm sure there's gonna be at least 2,000-3,000 more cars.
Fun. Are we in announcement section?
So this would be a good resolution. Dealing with this question about the Bronx getting a benefit for
Yeah.
increased traffic, whereas Manhattan is not getting anything out of this.
And we should look at the asthma rates right on 176, 77. When 95 is going to,
Yeah, we missed John Culpepper, remember?
I thought, my asthma really popped up just today. Because I was cleaning my house.
No way.
So no, I got my asthma acting up today.
Wow.
You have a
The
walking
weather.
path now?
You didn't use environmentally sounds, cleaning products.
No, I
There
didn't,
you go.
yeah,
You
well,
got it.
okay, we can go into greater depth on this,
Yes, we're
but I
not
think
going there.
I think I'll spare myself some embarrassment.
Okay.
Any other new business? Very good. Did you say you had an announcement?
Yes,
Okay, it's time for announcements.
okay.
Ms. Camera, make your announcement.
Okay, Positive Tales will have a wellness and vaccination event on May 11th in the Bronx. I will send the flyer to the office with a hope that they will email that. I hope.
You know, you weren't at the general meeting.
No.
And what is her name? India?
Indiana.
Indiana.
Mhm.
Indiana asked me a question, I believe, as to whether or not you were in touch with Positive Tales. Wasn't that her question?
I'm trying to think.
Yeah.
I volunteer with Positive Tales.
Question about.
This came up at the public safety meeting last night, actually, OC, and I'll share this on Indiana's
Which
behalf. Public safety.
Oh,
In Indiana raised a point about information that was circulating about an individual that was training dogs to attack cats. And she's been very concerned about that. Yeah. And so no one at public safety had heard reports of that. None of the precincts had heard reports of that, but we mentioned that you may know more about this, and we were trying to get her in touch with you. So that may be related to
I
all of
heard,
that.
and there is another indication of a dog owner that got arrested because he was beating his dog and somebody took a film and the ACC came in and picked up the dog. But they released this guy a day or two later, but he has 2 more dogs in the house on 100. Sorry, I'm not saying any addresses in public.
But you know something, there was a video that I saw. Where the hell would it have been on Facebook? Might have been on Facebook.
Yes, with the dog killing a cat.
Yeah,
No, wasn't a cat.
that was what Indiana was talking about.
I thought it was another dog.
Mhm.
On Dyman Street.
Yeah, I actually passed by there. It was on Earth Day. There was the DOT
Yes.
had a Earth Day event. I believe I saw you there. After I left the event, passing by in front of Pizza Palace, there was a pit bull that killed a puppy.
Yeah, it was another dog.
Yeah.
It wouldn't let go of this little dog.
That's
It
what
was-
people are. They don't let them.
It was brutal.
Yes,
And
the dog didn't survive.
yeah, no, it was just, the dog was ripped to shreds.
Yeah.
And there was blood all over the place.
Yes.
Any other announcements?
Yeah.
Well, I mean, let me just finish my announcement. So. it's gonna
Sorry, we
be-
got off track.
sorry. On May 11th.
Yeah.
The event will be in the Bronx. I'm sorry, but hey, the event is open to all New York City residents. It's gonna be, where is it? Okay, I'm gonna send the flyer to the office
Okay.
on, 860 Forest Avenue in the Bronx. There is a phone number to call if anyone have any questions, but people need to register in advance.
Okay, you better send directions. Any other announcements? I think we already announced that the Parks Department is showing In the Heights in J. Hood Wright Park on Friday at 8:30. But bring your entire families. Bring a blanket. And next month we have at this point possibly 3 presentations, including the Young Men's Clinic. Also the Stew Crew from the Wheel School. And Tanya Bonner is going to make a reappearance to talk about a study that she's working on with Columbia University on noise. And so we'll hear about that, the impact of noise in the community. So we'll hear about that at the next meeting as well. So I think we're going to bring this meeting to a close at 8:42.
Wow.
That's a marathon.
Wow.
Look at that.
It's.
Motion to adjourn?
Thank you.
Thank you. All right, thank you all for coming, and those of you in the internet world, thank you for tuning in. Take care.
Thank you so much.
All right, thank you for attending.
Have a good night.
Bye.
I'm sending the flyer to the office right now.
Hasta la vista, everyone.
Good
Yeah,
night.
pleasure seeing you.
Thanks for
Take
coming,
care.
Julia.
Well, it's because we had no presentations today. That's why we finished so
Oh, yeah.
early. I'm
Yeah.
like,
Do we have a presentation?
no.